There were several times when we really didn't think that Joel was going to make it.
Halfway through the operation, and we're very nervous as to whether or not he would actually survive even coming off the table at the time.
I felt like this might be a time that a patient dies in the operating room.
A fairly extensive operation to replace the aorta up to the head vessels, which required a halting of the blood flow to the brain while we replaced the upper aorta, and then required removal of the homograph and replacement of the aortic valve with a new mechanical valve.
The operation that I thought wasn't going to take as long kept on going longer and longer, and I was getting reports of how critical he really was.
In my 37 years, I have seen maybe 2 to 3 patients who have been in the operating room that long. That's a very long period of time.
I'm a very religious man in my own right, and I was praying. I went to my synagogue, and I was praying for him.
When we go in, we have no idea of how bad the scarring is going to be until we get in there. And it's almost like Forrest Gump said about life is like a box of chocolates. Well, doing reoperative heart surgery can be like a box of chocolates. You never know what you're going to get until you get in there.
That afternoon, Dr. Leidenfrost told me that things weren't going as expected. There was bleeding and they could not find the source of bleeding. And the first time I went into the operating room, Dr. Leidenfrost said that they were going to try to redo the surgery to try to find the source of the bleeding.
And getting that bleeding under control is a difficult thing, and the longer surgery goes on, the more difficult it could become. So he required a tremendous amount of blood products and the skills of a very skilled, experienced surgeon in order and also from our ultimate surgeon and doctor above that got him through the operation.
It did not appear that the bleeding had slowed from the hour prior. My concern level raised even more. Then I went back into the operating room, and Dr. Leidenfrost did not feel that things were going to be a good outcome. I think at that time, Donna and her sons, I know for sure, and Joel's sister, knew that that they probably have lost their husband, father, brother, friend. And if you've ever been there before, losing a loved one, it's a pain you can't understand.
And the entire medical team wouldn't give up. I think that there are places that would have. They just said, this is it, we just can't.
All of a sudden, the products turned everything around, and Joel stopped bleeding, and they were able to close the chest, which is another thing that I wasn't 100% sure they'd be able to do.
And help from above is a critical thing that we have to be very well aware of whenever we're taking care of sick patients.
When I returned to work the next day, I was very happily surprised that Joel had survived surgery and he had survived the night, and he had woken up, he was moving all his extremities, and just elated, just totally elated that he had survived the surgery.
I get out of my car after that, and I walk in, and the first 2 people I see are Donna and Joel's sons. And I just teared up because I knew that meant Joel survived.
I couldn't wait until I saw that he woke up because one of the problems, because of the blood flow to the brain is compromised. It's not normal during this kind of an operation.
They told me he had already moved, which is a total miracle.
Not only did he wake up, but he did so well afterwards, and from being so close to death to getting to this point is really a miracle.
Over the course of the next several days, you can't imagine how ecstatic everybody was in the hospital that he not only survived the surgery, but woke up and was doing everything to command, and I believe was off the ventilator within 4 days, and And it was down to our step-down unit within 7 days. And it's just remarkable. It's just it's a remarkable surgery. It's a remarkable recovery. And it's a remarkable family. Thanks be to God.